We expect these guys to be normal after surgery. There's other surgical procedures out there for hip dysplasia, but they're salvage procedures. My name is Mackenzie. I'm a board certified veterinary surgeon, and I work at Affiliated Veterinary Specialists Daytona, as well as Affiliated Veterinary Specialists in Jacksonville. Total hip is to address issues with the hip, may it be arthritis, chronic luxation. Typically, it's the larger breed dogs, Labradors, Rottweilers, Golden Retrievers, German Shepherds that have had some either congenital degenerative joint disease, hip dysplasia mainly, or they've suffered a hip luxation or a fracture that is healed inappropriately, and they have pain and discomfort in those hips, which really affects their quality of life and their mobility. Total hip does is we're basically replacing the ball and socket of the hip joint. And what that does is give them a normal range of motion, relieves them of any pain and discomfort, and improves their overall activity level, mobility, and comfort. A lot of owners will notice just dogs are slow to get up. Typically, we don't like to do the total hips in dogs that are younger than 10 months of age because they still have growth to do, their bones are still soft, and so the implants may not seat appropriately. So we definitely want to wait until 10 months to a year as far as being too young. As far as being too old, really there's no dogs that are too old. Their bone quality may be a little bit questionable. So this is Angel. These are her preoperative x-rays of her pelvis. And you can see she's got a lot of bony changes here. This should be a nice, clean, round ball, and this should be a nice, smooth, clean socket. And you can see she actually has dysplasia on both sides, her right being more affected. And even though she's got severe arthritic changes in her hips, she's still a candidate, and we know we can make her better. So here on the right side is the postoperative x-rays. We've removed the ball of the ball and socket, replaced it with a new femoral component, and then a new ball or femoral head. And then we've placed a new cup or socket there, her acetabulum. So now she has a nice, frictionless, normal range of motion hip on that right side that will give her comfort and be pain-free and back to the level of activity she was accustomed to before.